Hey guys, this is Dr. Subramnani and welcome back to the channel and welcome to the MAM Show, a show where we dive deep into the lives of people in the medical field and try to gain from their knowledge and experience. And today we have someone you already know him. Let's play this guessing game. An established breast surgeon, a teacher. I think you already have guessed who is it by now. A mentor, has also cleared his USMLE'S, has also done MRCS, has also done fellowship from abroad. Basically, he's done everything from studying to playing cricket to photography and everything. And we can learn a lot from his experience. So, without much further delay, let's dive deep into it and let's welcome Dr. Rohan Khandelwal.
So first of all, Subha, thank you for having me on my show. I will admit that I'm a regular follower of your YouTube channel and Instagram channel. I think so. You're doing a great job, and it's an absolute pleasure to be talking to you. And in fact, I have been telling all of you, those who've been on social media, that it's a learning process for me as well. Just the whole setup before the show, how you were telling me how to go about it. So for people like us, it's a great learning experience to be talking with YouTubers like you as well.
Hi, sir. Welcome to the show, and it's really an honor that I've got a chance to talk to you and learn from you firsthand. And obviously, many people who are seeing this video, it will also help them. And this is going to be a great session. I already know that. And just the overall theme of the session, we'll keep it as for the people who want to be a surgeon or who are already in the surgery life, residency, and everything. So, first, let's address the people who are aspiring surgeons, us medical students. So, let's start with the basics here. So, for someone who's starting out with surgery as a subject in their penultimate year or final year, what would you advise them?
Now, surgery as a subject, students, when they enter medicine, I think so most of that there is a direct inclination towards medical subjects, more towards medical subjects, because surgery has got more to do with seeing things and doing things then. So, my advice to all students when their clinical postings start in second year, they should be very regular with their clinical posting, especially surgery, because it's not a theoretical thing. You can't learn the theory of surgery and understand it. You actually have to see things. And something which I find very odd these days is that when I take classes or when I interact with students, they tell me that they're not allowed to go to the OT, or they haven't gone to the OT all till their final year or till their internship, which is very surprising. Now, maybe we were the first batch in our medical college, so we were the pampered lot, and we were allowed to go into the theater and even wash up for cases in second, third year. Just stand there, just holding a retractor. But that was a great feeling, a great learning experience. So, somebody who's approaching surgery, I think so it's a very hands-on thing. When you go to your clinical postings, keep your eyes, ears, all your senses open. Even the sense of smell, because we were taught that this particular case is a case of gangrene, would have this kind of a smell, and our residents used to tell us that when we were in the emergency, they used to say, "अरे लग रहा है फोनियास गैंग्रीन का केस आ गया. I can smell one." And so those are the things which you pick up, which is like practical knowledge, and that's what one should gain to get some interest into surgery. Of course, my recommendation in second, third year is that go to your clinical postings, and whatever you see in your clinical postings, come back and read it from your clinical methods book. And I am still a huge admirer of S. Das, the way that book has concised all the clinical knowledge. So just read it from that and read the relevant theory then. Okay, so somebody who's in second, third year, by the end of third year, I usually tell students that you should have done at least 15 to 20% of surgery, which would include all the major cases which you will see in your clinical postings. Final year is something where you have to finish your surgery. So any resource which you're using, I'm not here to promote any resource which you're using, plus Bailey, which is the standard textbook. So there are two types of students. One are the types of students who first like to read Bailey and then watch the videos, and others are who first like to watch the videos and then read Bailey. I think so. Both the options are viable options, are time tested options, and they can, yeah. So I mean, it depends on what kind of a student you are. Rather than me generalizing, a student has to analyze what would be most suitable for them.
Okay, so actually, sir, we've covered our next question already, which was about the resources. And as you said, undoubtedly, the number one resource should be clinical posting, okay, attending them very regularly. And you said you're a big fan of Estas and Bailey and all. But are there any other resources if this is not enough, to supplement all this?
So I feel in MBBS, because you have to cover 19 subjects, you need
Yeah.
to have a very clear understanding that these are going to be my resources for each subject. There's no point doing a lot of resources, taking a lot of resources and not being able to finish them then. So
True.
these are the bare minimum: your clinical postings, ESTAS clinical methods, whatever resource you've used for your notes or videos, and Bailey.
Mm.
Right now, students ask me, can we use some Indian author before the exam? Well, I feel all the resources will cover up parts for your entrance exams and for your college exams. But if you still are suffering from that FOMO that everyone else is reading and I'm not reading, you can
Yeah.
use any Indian author to pacify your nerves. But I think so. I'll leave it at that only. I would still say that you should read Bailey, because it's a beautiful book and you get direct questions from there as well. In addition to that, what I had in my final year, and I had my father's McGregor's. So McGregor's was a surgical anatomy book. It was a small, short book, and it was my father's book which I had. So it was almost 20, 30 years old. But of course, anatomy doesn't change. So that's a
Yeah.
beautiful book to read along with your surgical postings.
Yeah, also I've seen from my experience, like when I studied anatomy in first year, and then we study surgery in final year. In that gap, we've forgotten most of the things. So, like the McGregor's clinical anatomy, which you mentioned, would really be helpful in supplementing, this Estas and Bailey. So yeah.
Useful as well.
And so, sir, what are some of the
Yeah.
habits and ways students should incorporate to crack these exams, like FMG, Next PG, NEET, and all? Because these are MCQ exams, they require time management, test taking skills, and all. So, what are some habits and ways students should have to crack this exam apart from their regular studying and all?
So first of all, I feel that whenever you talk about any entrance exam, a student should have faith and believe that they can crack the exam. And one thing which I want to highlight is that it has got nothing to do with your college performance. I have
Yeah.
seen students who are mid rankers in college or even last benchers not doing very well in college, but they do exceedingly well in the entrance exams, and vice versa as well. So, first thing is that okay, college exams are done. This is a totally different ball game, and I can
Yeah.
do it. So, having that faith or belief is extremely important. The second thing, which is of paramount importance, is to be disciplined, right? So, first plan, and then implementing that plan requires a lot of discipline,
Yeah.
right? So, I have seen dreamers and planners, but sometimes they are not good implementers. So, whatever you're dreaming and planning, you need to implement it as well, right? Like I'll give you two examples. One is if you read about financial literacy, and if you read about Warren Buffett, who's one of the
Yeah.
most experienced and well-known investors. So he's also said that investing and wealth creation is a very boring thing to do. And I would extrapolate it to your entrance exams as well. Doing the same thing, the same routine is very boring, but those boring acts only give you great results in the end.
Yeah, so be it any exam, consistency matters. The routine of doing everything daily, that matters, and implementation rather than planning and organizing it.
No, planning is important, but planning and then
Yeah, yeah, yeah.
implementing it is equally important.
So most of us leave it at the planning stage, and like we'll do this subject first, and then this subject, and then we fall behind, and then we have to do rush everything. Basically, a story of every student's life. But we need to manage it. Uh, that that's student's life.
And the third thing is, I mean, stay away from the FOMO factor, right? So I always tell students in my class that when you're preparing for an exam, it is unfortunately a race, right? And come what may, I mean, you can
Yes,
say it's
yes.
a rat race or whatever you want to call it, but it is competitive at the end of the day. And if you've seen competitive races, those people who look forward and run are the ones who run fast, right? If you
Yeah,
keep on looking to the
yeah.
side, you will slow down.
Not look sideways.
So that is another thing.
Yeah, like the horse.
Right, correct.
Yes.
Like the horse. So look straight and run fast and focus on your preparation, not what your friends are doing.
Yeah, yeah. It leads to students be
Yeah.
like, तूने इतना पढ़ लिया and all, and then it leads to toxicity. And then instead of, climbing up your own ladder, students, tend to pull the others down because of this toxicity, which is not right. So yeah, I mean, good point. We should focus on our own journey and preparation, and I completely agree with that. And moving back to our this thing. Now let's say student is focused on their goals, studied for their exams, and cracked the exam. Now is the time to enter residency, surgery residency. So, what am I looking at? How is the surgery residency? What am I expected to know? How is the work life balance? What am I expected to do every day? And everything else. So, what is it like?
So I feel all residencies are, challenging, but surgery residency is particularly grueling both physically and mentally. Right. First of all, what happens is that all students are, in the preparation mode, studying 10, 12 hours a day. They're not used to that much of physical workload. And when they enter residency, it's like a shock for them, right? Their bodies are not used to it, their mind is not used to it. So the first 2 months are almost like a blur where you're just running around and you're doing all the scut work and everyone is shouting at you. And for sometimes you think, why are they shouting at me? I haven't done anything wrong. But I guess that's residency. And a lot of students think that that only happens in India. No, that happens in America as well. I have done my rotations at Harvard, Hopkins, and Cornell, and I've seen first year residents
Yeah.
get, I mean, their lives are hell in the first few months. So it's the same all across the globe, especially in surgery. Now, in surgery, it's very important to build a strong rapport with your seniors because that is what will help you to learn. Then only they will trust you with the things. So, both on a professional and a personal level, to strike a good rapport, and the earlier you build the sooner you build that rapport,
Okay.
the more comfortable your life is going to be in residency. And another thing which people should remember is to take care of your health. I have seen students losing 7, 8 kgs weight when they join first year residency, more than that in fact, sometimes as well. And I was 57 when I joined my first year residency, and I was 54 by the end
Yeah.
of it. So I mean, there wasn't much scope of losing weight, but still I'd lost 4, 5 kgs of weight. So to take care of one's diet and take care of one's health is important. Whenever you get a chance, eat something, keep yourself hydrated. That is also very important. Don't worry too much about studying in the first 6 months or so, because your knowledge which you're carrying
Yeah.
will carry you forward. learn the practical skills, learn the common procedures. They are very important. And another thing which I want to tell residents is that, in the first
Yeah.
6 months or so, if you're not getting a lot of cutting opportunities, it is okay. You are going to be cutting all throughout your life. You're going to be operating all throughout your life. So it really does not make a difference whether you start 2 months later or 2 months earlier. So get adjusted to the system. It should not come to a point where you want to quit surgical residency, where I have seen such students as well. So get used to the system, and things do get better with
Okay,
time.
okay. So surgery residency,
Yeah.
from
Yeah.
holding a retractor in medical school to performing the surgery and procedures actually in residency, it's a very big jump. And as a med student, we barely, I just observe the
Yeah.
procedures, hold retractors, and do small things. And as a resident, we actually perform the procedures on the real patient. As a med student, we may practice sutures on banana or a robotic arm or something, but as a resident, there is someone's body where we perform all these procedures. So how can I ever be, feel prepared for it? This is such a big jump, and yeah, this is a big jump. So how to be fully prepared for it?
So I think so. Yes, the amount of responsibility is much more. As a medical student, when you're performing any procedure, you're holding a retractor, that sense of accountability is not there. But when you're doing it as a resident, you have that sense of accountability as well and responsibility as well. So I think so. It comes with time, and it helps to have a great group of seniors and your friends around you. That they help a lot as well. If your senior is just standing there while you're performing a procedure, gives you a great sense of confidence that there's somebody there. And that is surgical residency, where you see one procedure, then you do one procedure under supervision, and then you do it independently, right? Of course, by one I don't mean one. There's a learning curve for every procedure, but that is what surgery is all about. So I think so. You get accustomed, or you get used to that with time.
Okay, so general surgery residency started, and most of the procedures, like I'm assuming this, I don't know this because I've not done surgery, but I'm assuming like from what I medical student impression, like most of the surgeries which come in are appendectomy, cholecystectomy. I don't know if it's true, but yeah, this is what a medical student's perception is. And basically the usual suspects: appendectomy, cholecystectomy. So does it seem to get a bit monotonous after a while, let's say in final year residency or something like that, that you are repeating the same procedures again and again? How is it? Does the life of a surgeon gets a bit monotonous?
No, I don't think so. I mean, there are a lot of procedures which you perform as a general surgeon during your residency, so it doesn't get monotonous at all. But I would like to address one point here, and this was asked to me by a few people when I was taking up breast surgery. They said that you're taking such a specialized thing, so you'll just be doing at the most 10 procedures. So doesn't it get boring for you? I said I look at it from a different perspective. The way I look at it is that I can be an average surgeon if I'm doing 50 procedures from head to toe, or I can be extremely good in performing those 10 surgeries for the rest of my life. And it depends on your mentality. Again, it varies from person to person. I don't get bored with that. I don't get bored doing the same thing again and again, but doing a good job. Whereas somebody might get bored and they would like to be a general surgeon performing everything from head to toe. So it depends on person to person. I mean, I'm the kind of guy who, if I go to a restaurant, I have a favorite dish, that is what I'm going to order. Right? That is what I like. So I don't get bored with that. So it depends on your nature. Yeah.
Yeah, I don't know who said this. I think it was Bruce Lee, that he said that I'm not scared of the person who knows 100 different moves. I am scared of the person who knows one move and has practiced that 100 times.
Absolutely.
So yeah,
Absolutely.
we can look it as expertise rather than monotonous. Yeah, like your perspective. Expertise is more, better than like a monotonous lifestyle if we change our perspectives on
Correct.
it.
Delivering better outcomes. And I think so surgery is a lot to do with outcome driven approach, which is what is being focused on these days.
Okay, so about residency now, coming back to our path which we discussed now, like after student cracking exams, I am in residency, and now I've reached a point where I have to decide where I want to specialize in and if I want to specialize in. So, what should I look for when I'm, thinking about this? How should I decide? How much time do I need to give to it? And should I start this right after residency, like the fellowship? Or what is advice? What to do about it?
So there are a few things which I would like to mention here, Subhav. So number one is that there is a role for a general surgeon as well, and a lot of students ask me this: what if I don't specialize? What if I don't do a fellowship or an MCH? Is there a role for a general surgeon? Absolutely. There is still a role for a general surgeon, not only in tier 2 and tier 3, but even in tier 1 cities. And I know a lot of them who are doing exceedingly well. So that is number one. So it's not necessary that you need to specialize or do an MCH. Second, if you want to do an MCH or a fellowship, there are a lot of options open. And there are students who know right from beginning what they want to do. Like now the results have come out, and two students who are interested in taking up surgery at AIMS have given me a call, and they've said that we've always wanted to become neurosurgeons. So can we take the integrated 6-year course directly, because we want to become neurosurgeons only. Okay, so one is that kind of a student who knows right from the beginning that I want to be a neurosurgeon, I want to be a CTVS surgeon, right? Like for me in second year of my undergraduation, I was very clear that I wanted to be a surgeon, and by final year I was very clear, final year of MBBS, I was very clear I just wanted to do breast cancer surgery. Why? Because I've had family members, I've had friends, mothers who've suffered from breast cancer. Some of them have passed away, and that was my motivation to go into this field and to deliver better outcomes, right? For the other set of students, the exposure which they get during surgery is what drives them towards the super speciality. Now, unfortunately, in India, when you're doing a residency, most of your exposure is in GI surgery, right? Which is why you will see that majority of the students want to become GI surgeons. So, getting exposure into other subspecialties, talking to other subspecialists, attending conferences, all these will widen your horizon and will give you a better perspective regarding which branch to choose. Your second question regarding when to start preparing. So, I usually recommend the final year of your MS is when you should get serious about this, and you should start thinking on those lines.
Okay, so finally, a residency is the time where we should start looking into it properly and studying for it and all. But is it possible? Like, how is it? Is it possible to rotate in this different subspecialties while you're in residency, or how is it?
Yeah, absolutely. So you do get rotations during your residency where you rotate in the subspecialties. But even otherwise, you're sitting in the college canteen, you're sitting in the hospital mess, you'll have all the people coming there. So talk to them, know what they're doing, what are the latest things happening. You can request them that, can I just come to your theater? So that's how you learn. And I think so. I love the Three Idiots dialogue कि ज्ञान तो हर जगह बट रहा है, मतलब जहां पे भी जाओगे मिल जाएगा. सो इट इज यू हैव टू मेक एन एफर्ट. ठीक है. सो आप अगर एफर्ट करोगे एंड इफ यू अप्रोच अ सर्जन, कहोगे कि आई वांट टू कम टू योर थिएटर, कोई मना नहीं करता. So that is how you broaden your horizon and you learn more in the surgical branch.
Okay, so now we discussed that surgery work life balance is very hectic. You mentioned about waste lot. Now looking back at our path from medical student to residency, and now our goal is finished. We've also done residency, whatever subspecialty we want. Now the goal is finished, and we are an established surgeon like you. So, what is life as an established surgeon like? The emergency calls, कि 3 बजे call आ रहा है, come for emergency and all. So, what is, let's say, a day in the life of Dr. Rohan Khandelwal? How does it look like?
Okay, so let me first talk about a day in my life, and then I want to make a few points here because of my branch, which does not have many emergencies. So I'll give you two examples. One is my normal day, and one I'll share one of my friends who is a general surgeon, right? So my day routinely starts. I mean, I'm an early riser, so I get up by 5:36. I'm up, and I'll do some yoga, do some exercises, water the plants. By that time, my daughter gets up. So if I don't have a surgery posted that day, which these days is quite uncommon. I mean, I am operating almost every day. But if there are no surgeries posted, then I would, spend time with her, drop her to school, and then go to the hospital. Otherwise, on days when I have surgery, I like to start my surgeries by 7:30, quarter to 8. My first case starts. So I'm there in the hospital by 7:30, and we start the case by quarter to 8. I am in the hospital, so I follow the American method. In America, when I was doing my rotations there in my training there, we used to round at 5 o'clock in the morning, right? By 7:30, the case used to start, and by 5 o'clock, everything was done. Everyone was going home, and then they had time to themselves post 5 p.m.
Yeah.
So it's pretty much the same with me. I wrap up by 3:34, and I'm back home by 3:34, and then I have time for myself and my family. So that would mean probably going swimming, either go play cricket, or if I have my teaching commitments, I would record my lectures, do some sessions. That is what I'll do. So that is how I have struck a work-life balance. I'll pursue my hobbies. You can see some of my pictures at the back. So I'll go. I love photography. I'll go to a sanctuary, click pictures. So that's how I have, planned my day. Now, this is because of breast surgery, which does not have a lot of emergencies. But other branches like general surgery, oncosurgery, neurosurgery, you do have emergencies. And surgery is one branch where to have an independent name, it would take some more time as compared to a medical branch. Okay. So even when you pass out from your surgical residency, you'll do senior residency, then you work under some surgeon. So till 30, 34, 35, you are still, working under someone. And then you start practicing independently. And if there are emergencies, you have to attend to them. So my other friend, he's a busy general surgeon, does almost 45 to 50 cases a month. And he will be operating almost every day, even on the night time or Sundays. He has to sometimes do cases, but I've seen him still take out time for the gym, to go swimming. So what I want to tell budding surgeons is that it depends on you how you want to devise your day, right? If you want to work, there is enough work where you can work from morning 8 till night 8, but for how many years will you be able to do that? So correct. So at one point of time, you have to say, look, no, I'm just going to work from 8 till 5 or 8 till 6, and then I will take out time for myself. And I personally feel that the sooner you do that in life, the happier you're going to be. Don't leave it till too late.
Yeah, we can already see you have so many hobbies, photography, wildlife photography, cricket, swimming, spending time with family. So I think we can look for a work-life balance like this and aspire for a work-life balance like this. But coming to our next question is that, which is also a mystery, that why did you choose to practice in India?
Before that, I'm sorry I'm interrupting you, but there is one thing which I want to mention about residency, if you permit me to. So, one thing as a surgeon which is very important, and this is more so in a surgical branch, is to have a very good mentor, right? And this is something which we did not talk about. So, because I told you it is something which you have to learn from somebody, that Guru Shishya thing holds true in surgery. So, as a surgeon, try to find a good mentor who can guide you during your residency and post your residency as well. And that bond which you have your mentor is a bond for the rest of your life. So it is very important, and I've seen a lot of successful surgeons have very good mentors.
Yeah, yeah. Mentorship is important in every aspect of life. It seems not only in surgery. Like for
True,
example, when
true.
when I was in medical school, when I wanted to go into medical school, and I was in school, in 11th, 12th standard, I took science. You won't believe me, I did not know that we have to give something like NEET UG, for example, to enter into medical school, because I'm like the first doctor in my family. I had no mentorship, no friends, and anyone basically connected to this field. So I really lacked the mentorship, and maybe if I had known that there is this exam and I would have prepared for it extensively from day one, maybe the story could have been different. But yeah, so I really feel the essence and importance of mentorship. And nowadays, social media is so good. For example, many students reach out to you, and you answer them whenever you have the time, and there is so much exposure on social media that we can get mentorship from there also.
Yeah, and also, I mean, I love to say this line that surgery is a way of life. So, surgery is way beyond what you're doing in the hospital as well. And the discipline which you require as a surgeon, you tend to inculcate that in your life as well. And a lot of these aspects, you tend to inculcate as a surgeon in your life as well. I think so. As a surgeon, you're not only a surgeon in the theater; you're a surgeon for in your life as well.
So yeah,
Yes.
now talking about that, you now practice in India, but you have also given a USMLE, MRCS, and everything. So why did you decide to settle down and practice in India when you had lucrative offers from abroad? What was it?
So a lot of students have asked me this question, and I would like to tell everyone here that I was never preparing for the Indian PG exam. My main aim was USMLE, and I'd been working for USMLE ever since second year of my undergraduation. So by the final year, I had 5 international publications. I used to go for conferences, present my papers, and I was very focused that I wanted to do surgery in America. So never prepared, never studied for the Indian PG exam. I cleared all my steps during internship, did my rotations, all set to apply for the match. But then two things happened which really changed a lot of my decisions. Number one, we were the first batch in our college, and the college and the university did not release our degrees on time. So because of that, I could not get my ECFMG certification just because of my degrees. My exams were clear. I couldn't get my ECFMG certification on time, and so I couldn't apply for the match on time. Despite that, I had 11 calls in surgery, and from the likes of Mayo College as well, which I still regret that why didn't I go for that interview, because that would have been a great experience. So that was the first thing, and the second thing was during this period when my degree was not getting released, the Indian PG exam was about to take place, and me and Dr. Rilla were already engaged by that time, and so there was pressure from our families that just appear for the exam. I mean, just appear for it, whether you've prepared or not, just go for it. So I went for the exam. I was the most chilled out person in the examination hall. Everyone was tense. They were going through their books. I just went there, marked. I was very aggressive because I had nothing to lose. And as luck would have it, I cleared the exam. My rank was not outstanding. I mean, it was not in the top 10 or so, but or top 25 or so also in my university. But as luck would have it, more seats were added that year. So I got a surgery seat, and at that time there was a dilemma whether my degree would come or not. So my parents said that at least take up this, and then you can always go for your interviews and you can go there. But once you join it, and I was lucky enough to get it at Safdarjung, where I did my undergraduation. All my seniors, whom I had seen growing up whom I'd seen as MBBS students, now I was working with them. So eventually, I decided that let me do my residency here. My exams are valid for 7 years, so I can always do my fellowship. So, which is what I did. Now, when we went for our fellowship, both me and Dr. Illa, we are very social, and we are very attached to our families. So somehow, Dr. Illa and me did not like the lifestyle there when we were there for an extended period. We somehow didn't enjoy it that much. So we decided to come back. And trust me, I have no regrets. No regrets in terms of opportunities here, in terms of lifestyle, and in terms of earning as well. There are no regrets. I think so. We are doing whatever everyone else is doing there. Of course, there is more pollution here, which I cannot change. And people say that the quality of life is better there. Those are things which I cannot change. We can make our lives better, but we personally have no regrets.
So, what about the story of MRCS? How did that happen? It's UK, right? How did that
Yeah.
happen?
Yeah, so MRCS was I think so, it was a routine in our college. So that is how we were taught at Safdarjung, that end of first year you will appear for part 1. Ours was part 1, part 2, part 3. Now it is part A and part B. So part 1 end of first year, part 2 second year, and part 3, which is the practical after your exams. So we were also following that trend, gave our MRCS. Then me and my very close friend Shailendra, who's a surgeon now in UK. So we cleared our exam. We went to UK, got our registration done. Again, what I realized in UK was that to become a consultant, it is a uphill task, right? And that was the time when there were very few opportunities. Now post COVID, still there are more opportunities. So it was an uphill task, and I thought that I would flourish more here. And by that time, I'd started teaching, and I was enjoying my teaching assignments as well. So that's how the thought of UK went away. We went there, saw the system, but again, we didn't decide to settle down there.
Nothing like India, right?
Nothing like India.
So I think we've covered everything, sir. Right from student, studying for surgery to residency to actually becoming an established surgeon. We also got to have a look at your lifestyle and the choices you made to end up where you are right now. So I think it was a great insight into your life and your experience, and you also mentioned points like mentorship, which was so valuable, and I really gained a lot from this session. So informative, and I was really glad I could speak to you one on one on first hand. And I'm sure when this video goes live, people would also get a lot of insight, and they would really really love the video. So any last words for the budding surgeons out there, sir?
No, thank you very much for having me on your show. Like I said, I'm a huge admirer of your channel, so it'd be great to feature there. Just my final words are, be true to yourself. You need to be disciplined, and like I said, it's a way of life. It's not just what you do in the theater. Um, I would again say that we are living in a very stressful era, so take out time for yourself. Strike a work life balance as soon as you can in your life. I'm not saying you can do that in your residency or immediately after your residency, but try to do it as soon as possible. Don't leave it too late. Those are the things which I would like to say. One last thing, I want you to ask. I want you to ask me a question in Hindi, and I want to answer in Hindi, because a lot of students message me and say that we don't think that you know how to speak in Hindi.
श्योर सर, श्योर, बिल्कुल। आप बताओ, आपको कैसा लगा ये सेशन करके?
मेरे से बताया सुबह, मुझे तो बहुत बढ़िया लगा सेशन, एंड आई एम होपिंग दैट वील बी एबल टू डू मोर सेशंस. मैं आगे भी करना चाहता हूँ और सेशंस आपके साथ, एंड एक सेशन हम एक्सक्लूसिवली हिंदी में करेंगे.
Okay, sir. Done. 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 So if the audience is stayed till the end, आप बताओ क्या टॉपिक होना चाहिए. सर के पास वैसी बहुत सारी हॉबीज़ हैं. देर इज़ स्विमिंग, देर इज़ क्रिकेट, देर इज़ फोटोग्राफी, वाइल्ड लाइफ फोटोग्राफी, वर्क लाइफ बैलेंस, बहुत सारे टॉपिक है. सर्जरीज, टीचिंग. सो आप बताओ, कमेंट करो क्या टॉपिक होना चाहिए हमारे हिंदी वीडियो का, एंड वी विल श्योरली मेक इट.
यस, राइट इन द कमेंट सेक्शन जो भी आप हिंदी में सेशन चाहते हो, वट एवर यू वॉन्ट, हम वो हिंदी में सेशन करेंगे पूरा.
And yeah, sir, thank you for coming on the show. And it was a great pleasure talking to you.
Thank you very much. It was a pleasure talking to you. Thank you. Thank you.